Hi, my name is Colleen Sandorfi, and I have been diagnosed with lipedema and lymphedema. Now that I know about my diagnosis, I'd have to say I've been suffering from lipedema and at least lipedema since I hit puberty. I was, a chubby kid, but always an active child. But when I hit puberty, my body went through changes that, I was the 8th of 9 children, and my parents hadn't even seen yet with my sisters. And it was interesting, like the severity of, hormonal changes, the weight gain for no reason, things like that were just inexplicable. And as a teenager, you think, oh, gee, it's just part of, your body maturing. But looking forward, into my pregnancies in my mid-20s, and just struggling with my weight my entire life, even though I've always been active and always been a healthy eater. It's what prompted me actually a year ago to try to seek out a doctor to help find out why am I suffering when I'm starving to death, working out, and gaining weight. Lipedema has impacted my life because as someone who struggled with their weight, there's always been, the body image issues that come along with any kind of, weight struggle. I have suffered eating disorder in the past. I actually was bulimic for over 10 years, which I kept hidden from my husband for that long, to the point that I did finally seek out help, professional help for my eating disorder. It pretty much started in college because I was doing a diet plan through, I've done them all, but they wanted me to get to a certain number, and because that chart said that for your height and your age you should be this weight, and I was literally eating less than 500 calories a day, working out probably an hour to 2 hours a day, and I couldn't for the life of me lose any more than what I had lost to that point. You could see my ribs just standing, but I couldn't get below a size 8-10 on the lower half. And for women's clothing, that's considered large. So it was just that mental struggle that triggered my eating disorder back in college. So there are a lot of impacts on life that, now looking back at it, had I been diagnosed with this 20 years ago, I would have tackled it like I have now, but it would have changed my quality of life. And where I am at this stage, I'm trying to improve my quality of life moving forward. So I know that's a long rambling answer, but I really, I guess it's difficult to put into words how this really has impacted every angle of our lives. I did go to an endocrinologist back in Massachusetts, where I'm from, and I was very lucky because after running every test known, full glucose, just everything top to bottom, my test results presented as, a very healthy person. So again, I was very fortunate to find a doctor whom she believed me when I said, I eat right, I exercise, I can't stop gaining weight. I'm not myself anymore. I'm getting less mobile, less active, the pain of going up and down stairs, starting to develop some knee pain, which I'd never had in my life. It was just to have a doctor, listen to me and believe me when I said, I'm not binge eating, I'm not eating junk, but for some reason I'm gaining weight. She was like, I think it might be this disease called lipedema. I came to NYC Surgical Associates because I had that official diagnosis of lipedema and lymphedema, but for me personally, I wanted individual health care that was focused on the holistic entire person. I liked Dr. Bordison from the very first time I met him because he was a realist, and he spent as much time with me as I needed and explained things, worked through things. We were a team. It wasn't, he was telling me what to do and I had to do it. He wanted to know why, what my concerns were, how I wanted to try to tackle my treatment. And, we made decisions together. Here I am less than a year later. I've been through several venograms. I've had several ultrasounds done with Dr. Bordeson. I had vein ablations on both legs to try to help improve, my vascular health and blood flow. But again, these are things that I never would have known about. I have currently 8 stents put in place in my iliac vein to improve vascular health. But it wasn't that he went in one day and let's put 8 stents in and see if it helps. That was over several procedures and testing each time and measuring improvement. And as someone that I do think I'm very conservative when it comes to my health choices, because I know that there is no pill that's going to fix this. I don't think jumping into surgery is something you should take lightly, for surgery of any kind. But I really did look at this as, how can I find a healthcare partner that will take care of me as a whole person and improve things. And when it came down to it, we've made every decision together. And the staff here is outstanding. When I have a procedure, it's the same face every time. I've said it several times to other people, but I really do sincerely mean that if I didn't trust these people with my life, I wouldn't be here right now. I'd still be looking for someone up, in Massachusetts. And while there may be a resource up there available, I haven't found them yet. And, I'm here today so that I can help educate others and try. If one person gets help from this practice, because I am speaking today, I feel better that I've at least, helped advocate for this unknown disease.
Hi, my name is Regina Pecorella. I came to Dr. Bordeson to be treated for lipedema as well as lymphedema. I've been suffering with lipedema all of my life. I did not know that was the name of the condition when I had it. All of my life, I was always just called thunder thighs. It always broke my heart, no matter who I met. I just saw their eyes going down to my legs, and that's all I saw. As a teacher for 20 years, my legs have always been big, and they've always felt swollen and heavy, and I was in pain 24/7. So as a teacher who stands on her feet all day, my legs always hurt. They always felt heavy. And by the end of the day, I wanted to cry. So emotionally, it took a toll on me, and physically, and I wanted to find help. I've had several surgeries in my life. I'm going on number 14 next week. I'm having another spine surgery next week. Throughout all of my surgeries, my legs always felt like they were getting bigger and bigger and bigger, I guess from lack of exercise, lack of movement. So I did see several vascular doctors, and they pretty much just told me, from all of your surgeries, from not being mobile, from not moving around, this is just who you are, and you pretty much just have to live with it. So after being tossed around from doctor to doctor, I said, I'm gonna give one more doctor one more shot. I went online, I found NYC Surgical, and I said, let me just go see this Dr. Bordeson, and let me go talk to him. And the minute I walked through the doors, he approached me. He was a gentleman. He was honest with me. He was respectable, professional, sat me down, and as a teacher, I have 25,000 questions for everybody. And unlike all the other doctors, this gentleman answered every single one of them. He made me feel comfortable, and he said to me that he promised me that he would be able to help me. And I believed him, and I'm glad I did. So Dr. Bordeson diagnosed me with venous insufficiency syndrome, said that I wasn't getting enough blood flow to my heart as well as to my legs. So I've had, over the course of a year and a half, several procedures with him. I've had about 4 to 6, maybe 8 different stents put in my pelvis to open up the flow. So because of all those procedures, I do feel much lighter. My legs feel much lighter. I feel much healthier. And in addition to those procedures, we then went into liposuction, and I've had 2 procedures, 2 surgeries with him. I just finished my last one a few weeks ago, and they've helped me tremendously as well. I think I'm done. I think I have enough blood flow. I think I feel the best I've ever felt. And once again, I'm happy I've come.
Hi, my name is Carmen, and I suffer from a condition called lipedema. This condition had a big impact on my life. Physically, I was always tired. After long hours at work, I came home and I couldn't get up. I felt like I was 80 years old. I had pain in my legs. They call it the painful fat disease. It's true. I suffered from pain, from aches all the time. My weekends, I spent them at home because I felt sick all the time. And emotionally, I couldn't participate with my kids in events. I wanted to go out with my friends. I wanted to wear skirts. I wanted to, like all young women, wear dresses. I couldn't do that. And I wanted to look beautiful like I used to. I had beautiful legs, and all of a sudden my legs started transforming. And that affected me emotionally. I tried to overcome that, and sometimes you try to overcome it by yourself because it's so embarrassing to tell people. Even to face it with a therapist, it is so hard to go and say, hey, I hate myself because my legs look so fat. And most people think you're just fat. Go to the gym, stop eating. You can't do that. And you feel like you're a failure because you can't lose the weight. So imagine the toll that it takes on you, especially not knowing what's the matter with you. I did not know that it was a disease. I kept on dieting and going to the gym and hiring physical personal trainers, one after the other. And I couldn't lose the weight. I'm failing at losing the weight. I looked at my friends. Every time we go out, my friends eat, the fries and the hamburgers, and I stick with a salad, and I still didn't lose the weight. So imagine the emotional toll that this took on me. And it takes a lot. Prior to NYC Surgical Associates, I found a doctor in Georgia. I made an appointment and went to see her. She told me that I have lipedema and I fit the criteria. She looked at me for about 5 minutes. She said, yes, this is a typical case of lipedema. I already knew because I read online what a lipedema looks like after I read everything about painful fat disease. She said that she can treat me with tumescent liposuction. She can do a liposuction for me, and that she only needs 3 sessions, and I will look good as new. She spent about 10 minutes with me. I needed to have more questions answered, but she didn't have much time because she had so many other patients to see, and I went home with a lot of questions. I really didn't want to go for the liposuction immediately. I wanted to know what's the root cause for my problem. I did not want to treat the symptoms. I want to know what caused me to have the lipedema. And I kept on looking until I found the NYC Surgical Associates. After my last experience and the many questions that I had that were not answered, I kept on looking online for a doctor who can answer my questions. And I found the NYC Surgical Associates online that have been treating for lipedema. It was a surprise because it's so hard to find a doctor who treats lipedema, especially that I live in Texas and I couldn't find anyone who treats lipedema there. In Houston, and they say Houston is the capital of healthcare, and I couldn't find one doctor who treats lipedema. So I travel to New York regularly for work. And I looked at their address and I found that they were 5 blocks from the office that I visit regularly. So I was traveling that week. I called New York Surgical Associates and I said, hey, I'm going to New York on Monday can you please give me an appointment that weekend? I said, sure, we can accommodate you for Tuesday afternoon. That was Friday. I'm calling on Friday. I said, this is a long shot. There's no way they can fit me in. They said, absolutely, we can take you in on Tuesday afternoon. I thought, this is a match. This is a good sign already. So I took the Tuesday off from work and I walked to NYC Surgical Associates on Madison Street, on Madison Avenue. And I went in and everyone was smiling, and they led me into the office where someone came in and said, I'm going to do an ultrasound on your legs. This is the first time that someone was doing an ultrasound. That's when I felt like this is getting serious. So she sat there and she did a very, very detailed ultrasound. I kept on thinking while I'm laying on that bed, I wonder why she's doing an ultrasound. And this is a cardiovascular. I have never thought of a cardiovascular treating for lipedema. So after that, after about 45 minutes, Dr. Carmen walked into the room and he said, hi, I'm Dr. Carmen with his beautiful smile. And he said, I hope you have some time because I'm going to tell you about your case and we're going to talk and you're going to listen because this is going to be a long, evolved relationship because we're going to treat you and we're going to make you feel better. And I already started feeling better. So he said, sit down and let's talk about your case. You have lipedema, and to explain to you why we did the ultrasound, because in most of the lipedema patients that we have been seeing, we have seen vascular issues. We have seen that the blood is not going all the way back up. It's going back into the legs, which causing some vein enlargement. So he went into the medical explanation. Although I have no medical education and I don't understand anything about medical terms, but he was so, he explained it to me in such simple terms that it makes so much sense to me. It was logical, and when you talk to me in a logical way and it makes sense to me, I said, oh my God, this is so much, this makes so much sense to me. Now I understand why is this happening. Yes, and I started thinking about past experiences. Yes, this makes sense, that makes sense. And we're treating the root cause here and we're not treating the symptoms. So I was very excited. He gave me the time. He sat with me for about 45 minutes and he laid out the whole plan. I walked out of there feeling extremely optimistic. I called my mom and I said, I think I found the person that's going to treat me. This is a long-term treatment. It's going to take at least 7 to 8 months to see what's going to left and if I'm going to need tumescent liposuction. However, the day that Dr. Bortesan put the stents for me, I said, Dr. Bortesan, oh my God, it's like you flipped the switch. I feel like my legs are so light. I can fly. And he's like, yeah, wait until you recover from the laser ablation. You don't feel the pain anymore. I made the choice to put the stents and do the laser ablation right after that. So I condensed all the treatments in 2 weeks. That's why I did not give myself some time to feel the lightness. However, the next day after I put my stents, I could feel the weight lifted off my legs. I felt like I've been dragging some weight in my legs for 10 years and all of a sudden the weight is gone. Even though my legs are the same size, but the weight is gone. I don't feel like I'm dragging weights in my legs. That was amazing, and I was walking in the streets of New York and I told my daughter, oh my God, I feel like I'm flying. It's an incredible feeling. I feel like my life has already started to change. I think this is a long-lasting relationship with NYC Surgical Associates. I already love my doctor. He's amazing, And sometimes you feel your relationship with the doctor becomes like, you can feel the trust. If you trust your doctor, you know that this doctor is going to change your life. And that's how I feel.
My name is Robin Chavushalu, and I have lipedema. I have had lipedema since puberty, and I was diagnosed in 2008. Before New York Surgical, I have seen 3 separate doctors in Germany. They recommended vein surgery. After the vein surgery, they would do a series of liposuction procedures, of course with manual decompressive therapy. One doctor even suggested that he would open up the entire leg and sew it back up, and he said I would be wearing compression for the rest of my life. It wouldn't look pretty, but the quality of my life would be better. My eldest daughter found New York Surgical and started her appointments and treatments, and I first met her surgeon at her first procedure. And he was very knowledgeable. He was very excited about treating lipedema, and he was very concerned that everybody involved in my daughter's treatment had full knowledge and comprehension about what was done, why and why it was being done, which is very important to me. When I saw Dr. Bordigen for my procedures, again, he was extremely knowledgeable. He was very caring, and he's actually fun, to tell you the truth. Because if I can't have some fun, why am I going through this? You know, seriously, why am I going through this? So, and the staff is wonderful. If the staff wasn't wonderful, you know, no matter how wonderful the surgeon was, why am I coming here? Since I began getting procedures, began with ablations. So I had 3 ablations. Almost immediately after the ablations, I did notice a feeling of lightness in one of my legs, that the first leg that was treated, which I was shocked. I didn't expect it all. It was like one leg lost 15 pounds. Not that it lost anything in volume, but after a couple of days, it was noticeable that actually in circumference, I did lose some size. And then once the stents were put in my abdominal stents, and at the moment I have 7 stents, it was amazing. After the last stents were put in, it was like each leg, the feeling of heaviness, each leg lost about 25 pounds. I was so used to dragging around the weight and having a shuffling walk and also a waddling walk that used to bother me. I hated it. I hated like getting up out of a seat and then having to waddle, or getting up out of a car and feeling like waddling and then having to pull myself up and breathe in and focus on walking straight. Now I can actually walk freer. And something that was totally amazing that I didn't think about is that I have had an ongoing problem, which happens with older women, that I mentioned to my GP, I mentioned to my neurologist, and everybody put it down to overactive bladder. I've had a problem with urge incontinency that has been getting worse, and since there are so many products that are marketed for female incontinence, I thought I was just doomed to be purchasing these products for the rest of my life. After the last abdominal stents, it was like a magic wand was waved, and I no longer have the problem.
My name is Carmen Bordigen. I am a staff surgeon at NYC Surgical, and I am the director of Lipedema program. The majority of our patients come to us after exhausting many other options. Some of them see different doctors for their condition. and they've been told either to lose weight or increase their exercise capacity, decrease their calorie intake. Some of them are offered straight off the bat liposuction in order to make their look better, but they never address the deep down the pathology, and they never tailor their treatment to their symptoms. As the director of a lipedema program, most of my patients are patients suffering from this disease called lipedema. Typical lipedema patients come to us with two major problems. One is the cosmetic, how they look, how they see themselves, and the second one is the quality of their lives. Because of the conditions that they suffer from, they have very decreased amount of mobility, a lot of pain, and their quality of life, day-to-day life, is very compromised. Majority of our patients come to us after exhausting many other options. Either they've been told to lose weight on their own and their disease is directly related to their calorie intake, or they've been offered straight off the bat liposuction in order to make them look better cosmetically. The majority of these patients, either they did not follow through this kind of treatment, either because it doesn't really address the root of the problem or any of their symptoms, or they had failed procedures because, again, as their symptoms have never been addressed, simple liposuction did not really help them at all. At NYC Surgical Lipedema program, we do things differently. We approach the patients based on their symptoms and modify the treatment according to the patients personally. It's a very personalized medicine. We address their underlying pathology. We go through a diagnostic procedures. We identify the root of the problem rather than focusing only the cosmetic look, but much more comprehensive multidisciplinary approach. The difference in NYC Surgical is our approach to this disease. We have a very comprehensive treatment modality. This algorithm is efficient and comprehensive. That involves screening, identifying the underlying problem, and treat this whatever pathology they have, tailored to their symptoms.